What if I told you that a simple algorithm could determine your health fate, potentially leading you down a dangerous path? It sounds like science fiction, but predictive analytics is already making its mark in healthcare, and the risks are very real. Many people are unaware of the hidden dangers. As hospitals increasingly rely on data for critical decisions, they may overlook the invaluable insights of human intuition. Can cold numbers truly capture the complexities of an individual's life? Imagine this: you walk into a hospital for a routine checkup. The doctor quickly glances at the screen and makes snap judgments based on the data. But what if that data misreads your symptoms? What if it categorizes you as low risk, while a serious condition lurks beneath the surface? These miscalculations are more common than you might think. Algorithms can be influenced by biased data, leading to catastrophic outcomes. A misdiagnosis could leave health issues untreated, raising the stakes to a level you never anticipated. Consider a patient named Sarah. She feels unwell, but the algorithm insists she's fine based on her past records. Despite her instincts telling her something is wrong, the system dismisses her concerns. Days go by, her condition worsens, and the algorithm has let her down. This is just a cautionary tale; it serves as a stark warning. The more we rely on predictive analytics, the greater the risk of losing the human touch in healthcare. Are we truly prepared to gamble our health on impersonal data? Even more concerning is the trend of healthcare professionals depending solely on these analytics, potentially sidelining their instincts and the personal stories patients share. This shift could reduce patients to mere numbers. Finding a solution is complex. We must strike a balance. Data should enhance, not replace, human connection. Envision a world where doctors use analytics as a helpful tool while still valuing patient voice, a world where algorithms support healthcare decisions rather than dictate them. As you reflect on your health choices, ask yourself, are you ready to trust your instincts over a screen? The underestimated dangers of predictive analytics in healthcare could impact you sooner than you think. So the next time you visit a doctor, remember, data is powerful, but your voice is paramount. Let's discuss how to achieve that balance. In healthcare, every number tells a story, but those stories must be heard. Imagine you're in a hospital, relying on the system to make the best choices for your health. But what if the very technology designed to help you could actually put you at risk? Predictive analytics in healthcare sounds like a miracle tool, yet there's a troubling side that many overlook. Most people don't realize how these algorithms can misinterpret data, leading to dangerous decisions. Think about it: a machine processes numbers and predicts your treatment plan. But what if it misses critical details? This happens more often than you might think. A simple data error or an outdated algorithm can skew results, putting lives at risk. Now, picture this: you visit the doctor with a rare condition, and the system suggests a standard treatment based on similar cases. But it overlooks your unique medical history, turning what should be a straightforward solution into a potential disaster. Consider how many patients rely on these systems every day. What happens when they trust a model that lacks complete? This is just an abstract concern; it's a real issue that could affect anyone, including you. The risks don't stop there. Some hospitals depend so heavily on these predictions that they ignore human intuition. When a doctor's instinct clashes with a cold statistic, who usually prevails? More often than not, it's the algorithm, an unseen force steering your care. Here's where it gets even more concerning: a small data error can lead not just to incorrect treatments, but also to worsening conditions. Imagine waiting for a life-saving surgery, only to find out that the predictive model misjudged your urgency. Lives are truly hanging in the balance. But there is a way to navigate this complex landscape. The solution lies in blending human expertise with technology. It's about using analytics as a tool, not a crutch. Doctors need to ask questions and challenge the data instead of following it blindly. Think of it as a safety net. With the right balance, predictive analytics can genuinely enhance decision-making rather than undermine it. So the next time you're in a doctor's office, remember the numbers can only tell part of the story. That human touch, it's irreplaceable. What will you do the next time you hear a statistic about your health? Stay curious and remember that the choices you advocate for could save lives, yours included. What if I told you that something as seemingly harmless as predictive analytics in healthcare could actually put your life at risk? It might sound dramatic, but hear me out. Many people view predictive analytics as a life-saving tool, yet it carries underestimated dangers. Imagine making health decisions based on incomplete or inaccurate data. Let's dive deeper. Hospitals are increasingly using algorithms to predict patient outcomes, which sounds efficient, right? But what if those algorithms are flawed? What if they rely on biased or outdated data? The consequences can be serious, yet many don't realize this is happening every day. Picture this: you're a patient waiting for an important diagnosis. Your doctor inputs your information into a new system designed to predict health risks. But what if that system was trained on outdated or unrepresentative data? Your fate could hang in the balance due to a hidden flaw in the algorithm. Now let's look at the numbers. Studies show that predictive models often overlook critical details, meaning your unique medical history might not even be considered. That's pretty alarming, isn't it? The fallout can range from misdiagnoses to incorrect treatment recommendations. Take a moment to think about this. You trust the system to make decisions that affect your life. It's unsettling to realize that the very technology designed to protect us could actually put us at risk. Now let's raise the stakes. Imagine a hospital that relies heavily on predictive analytics. Fire cutting costs and saving time, but what about the quality of care? What happens when those algorithms fail? Lives could be at risk, yet doctors might feel confident because the data seems reliable. This disconnect is where the real danger lies. So what can you do? Start asking questions about the data used to inform your healthcare decisions. Is it comprehensive and up to date? By being proactive, you can advocate for better and more transparent practices. Also, demand more from your healthcare providers. Encourage them to invest in systems that prioritize both data and the human experience, that prioritize accuracy and accountability. We must hold these institutions responsible for the technology they use on us. As we wrap up, think about your role in this complex web of healthcare decision-making. Your awareness can drive change, so don't let algorithms dictate your health without